consejo comunitario. Y esta sería la reunión 35ª de este grupo y lamentablemente también será la última reunión de este grupo. Aquí están las instrucciones para interpretación. Sepan que tenemos servicios simultáneos en español, entonces solo haga clic en el icono de interpretación y de ahí seleccione español como idioma. Este icono aparecerá como un globo terráqueo al fondo de su pantalla y también finalmente pueden escuchar solo el audio en español. Haga clic sobre Mute Original Audio. Gracias. Back to you, Nestor.
Thank you, Laura. So for those who are listening in English, you can also select the little globe icon either at the top or bottom of your screen and select English. That's also how you'll access our ASL interpreters that we have here tonight. We also have closed captioning available. So to use closed captioning, click the closed caption controls either again at the top or bottom of your screen. After you select the closed caption button, you'll have to click show subtitle and it'll show up on your screen. And with that, I will pass it over to Nestor.
Yes, thank you, Ben. Welcome everyone to, as Ben just mentioned, our final meeting of the CAG. Want to start off by thanking you all and on behalf of myself, Director Kimmy Watkins-Starr, Greg Hodge, who have been the chairs of this committee, of this group, and just kind of going to go over some of what we're going to be reviewing in our final meeting, starting off, of course, with our welcome. We'll hear the final thoughts from our doc, our health officer, and as well as some reflections from our public health director. And then we'll sort of jump into a little bit of some reflections. Take a look at a recap of what we've done as a group, maybe what some of our accomplishments have been as a group over the course of the time we've been meeting, and do a little bit of reflections, appreciations, shout outs. So if there's someone who isn't here that needs to be here so that they could hear their shout out, feel free to send them a text, let them know that they should jump on so they can get their proper appreciation. And of course, if you are not muted, if you could please mute yourself, and if we could do introductions in the chat, that would be fantastic. So any thoughts before we jump into our agenda for today? Okay, all right. This is our last meeting, y'all. So, I would take advantage of each moment we have. Okay, I know, and this also, of course, doesn't mean that COVID has ended. We know that especially our most vulnerable members of our community will still have, we'll still be dealing with COVID, and we know that as a community, and we'll need to continue responding and continue doing the work that we've been doing, just that it'll take different shapes, different forms from here on out. And so, hopefully we'll get a sense of what that, by the end of this meeting, my hope is that we'll all leave with a sense of one, that we completed at least our first objective and that we'll leave here knowing where else we could plug in, what we need to continue doing, and what are the spaces we can sort of participate in as community members or as reps of different organizations and institutions, of where we will be able to plug in. So now I'll pass it over to Dr. Moss.
Thanks, Nestor, and good evening, everyone. I've been honored to be in this space and to hear from everyone who joins it at every meeting, and just wanted to thank you for giving me the opportunity to once again share my thoughts of where we are. This is a little bit different because it's it'll be the last one, and it's been asked to sort of step back and share my impressions. So, first of all, the winter really was milder than what we have seen previously, and that's because many people are better protected than they were before, and we have more tools than we did before. But the winter was not without costs, and it dragged on a bit like the weather. For me, it's been a constant reminder that we are going to continue to have people who are at risk for worse outcomes of COVID, even as it recedes from the lives of many people. And, regardless of anything else that changes with our response, we are going to continue to support people to stay healthy, not just from COVID, but also from the many other health issues that confront us. We, at the same time, conditions have improved. We are in a relatively long, quiet period now, fortunately. I think, as maybe many of you have seen, life is increasingly, and we've said this, we've gone through many waves of sort of stepping down the COVID response, but I think that it's even more true now than before, that life looks a lot like 2019 for many people. And I've come to accept the fact that that is how people, many people, that is where they want to and need to be, even though COVID is still with us and it's here to stay. And so, moving forward, certainly for my work, it's about balancing that with the need to make sure that people have the tools that they need to stay healthy. I also wanted to sort of think in terms of, just what I tell people, what I would tell, people who have questions about COVID. What am I thinking about COVID risk, and what that means in 2023? So, I still wear masks in crowded settings, and probably like many of you, if there's a lot of people in a space or it's not well ventilated, I think that's I don't feel the same as I did before the pandemic. I feel like there's a chance that I'm going to get COVID in that space, and I'm fortunate. Other people are probably at greater risk than me. But I'm still going to take precautions because, first of all, I don't want to get COVID. I don't think it's trivial. I don't think people, I think people should work to avoid getting COVID, and I counsel people that. It's going to happen probably for many of us at some point. It's hard to keep your guard up. But for people who are older adults or who have serious medical conditions, I say, look, there are things that you can do to stay safe, and I think they're worth doing. And it's going to be harder to know what's going on with COVID in our communities. I think, as many of you know, we are going to work in Alameda County to make sure there are some things available so people know what's in the wastewater, what's happening in the hospitals, so that they can get a sense, is the risk high or low. But for some people, I think there are going to be, my parents are in their 80s. I tell them, look, there are going to be times when you want to have the mask around. You want to make sure you're staying up to date on your COVID vaccines, and have a plan for treatment. And I think that is going to continue to be sound advice for many community members. One thing I've learned is really, to stop trying to predict the future. I don't know what the future is for COVID. I expect that we'll see waves, but I can't predict much beyond that. I have heard the White House polled experts who estimated a 10 to 30% chance of another Omicron-like variant event in the next 2 years. Now, I caution you all, this is a those numbers, I dug into it, they are like off the top of people's heads or back of the envelope calculations. There is a lot of uncertainty here, but I think the message is that there are going to be periods probably of higher risk at some point in the coming years, and so we cannot just fold up shop and go away. We have to be prepared to at least keep people informed and raise the flag when we need to, so that people can take advantage of those tools that we all know work. And it's tricky, we need to strike that balance between allowing people to kind of leave the worst of the pandemic behind and supporting them to be ready for whatever may come. I am very glad of all the partnerships we've built. Certainly this goes for me personally with many of you here in the room over the past 3 years. But I think also for the department and our whole agency, and that will be a foundation that we can rely on as we do just that, as we try to support each other for what comes in the future. The other thing is that I really, in my role, pledge to keep learning about COVID and supporting others to do the same, not just community members, but people who want to take the deeper dive, because as many of this is that in many ways it's been a long 3 years, but from a science standpoint, we are still really in the early days. We have so much to learn. We have so much to learn about long COVID, and the full story is only going to unfold over I think many more years. The last thing I wanted to just comment on is that we are really committed to in our work not losing sight of the people who feel the greatest impacts, not just of COVID, but of many other health conditions that have disparate impacts. And we know that there are deeply entrenched systemic factors, structural racism, economic inequality that drive these things that remain in Alameda County and are going to continue to operate both in terms of COVID risk and other things, even as all of this stuff continues to de-escalate. And we are going to continue to work to find the best way to support the people most impacted by COVID to stay as healthy as possible, even as we move into this yet another new phase in the evolving story of COVID and our response to it. Hope that wasn't too mumbly mouth, but I really appreciate the opportunity to come and speak with you all this week, and hope you appreciated that it wasn't just a bunch of slides of data tonight.
Any questions for Dr. Moss, or thoughts or reflections based on Dr. Moss's reflections?
No, just saying thank you to Dr. Moss. It's been a roller coaster, right? So appreciate all the partnership. I know we get put in a lot of tough situations with how decisions can be made. I don't envy your position, Nick. I know sometimes I'm like, whoa, wait a minute, how'd that decision get made? So I can just say thank you for the partnership and the dialogue that we've had over the last 3 years. And I think as a whole, Alameda County, we fought hard. We fought a really good battle. I think there's still a lot more to continue to do against the social determinants of health. But I appreciate your partnership, Dr. Moss, and of course, everybody from Public Health. Thank you, Nick.
Pastor Arlene?
Yeah. So one of the most fun things for me about being on this committee or whatever it is that there were at least two babies born during this time, and I got to see pictures of them. You probably don't want to put pictures up for a public meeting, but you can still send them to me in a text. And one of my favorite pictures is of Dr. Moss's son doing a nasal swab for daddy, with a Q-tip, I think. But it was amazing because, Dr. Moss claimed that he had never practiced that with his son, and yet he was not even 2 years old and he was giving daddy a COVID test. So anyways, yeah, so that's the one way of marking time. We have some children in this world that don't know anything but COVID, life after COVID. I also wanted to say thank you for your service, Dr. Moss. It's been horribly disappointing, and and part of the reality that people in your position have taken, have gotten terrible threats, and who would have thought people would want your head because you were a doctor? I mean, military people maybe expecting people that work in law enforcement expect people don't like them or are mean to them and stuff. But I don't know. It's really troubling to me what you and your colleagues in similar positions have had to endure. And so I just wanted to acknowledge that.
Thanks, Pastor Arlene. It means a lot to me. And I have to say I've been very fortunate compared to colleagues in other places. Alameda County is a very supportive place, a set of communities that really, there's a range of opinions, but people largely embrace what we've tried to do throughout the pandemic. And I also want to say that, it's not just me. I think many of you probably experienced versions of this in your communities or in your maybe in your families or in your organizations, or if you're putting yourself out there online. And so it certainly wasn't just health officers. I think anybody who was in the public space and advocating for public health was could have found themselves a target. So, but I appreciate that, and I felt very supported by even when I think, as Aaron referred to, sometimes the decisions weren't the decisions that everybody agreed with, that this was a place that was about we're trying to work together towards solutions, even if we disagree, and not about name calling, finger pointing, or frankly sharing misinformation. So appreciate that.
For sure. Yeah. Well, and just generally, I would also say to you and Kimmy, and I'm not sure who else to say, Lauren. I still remember getting contacted by Lauren and saying, Kimmy Watkins Tart wants you on this committee. I'm like, okay, why? And I know why now.
We wanted prayer.
You can count them. They wanted a chaplain, but you got other great clergy colleagues of mine who stepped up too and participated, and that was really neat. But anyway, it's been meaningful for me to be a part of this, and I think the thing that has meant the most to me is the true interest in what was going on in Cherryland, the unincorporated communities, and the respect that faith communities could contribute. Because, as my brother Aaron is sweet and respectful and appreciative, but not everybody is. A lot of people think that religious leaders get our credentials from Cracker Jacks boxes, and we aren't valued, or we're seen as mostly a part of the problem. So appreciate the respect and the listening ears. Thank you.
Any other thoughts or comments before we pivot to Director Watkins' start?
Yeah, I'll chime in. Yeah, also with the gratitude for your leadership, Dr. Moss, and the whole Public Health Department's partnership. I guess it's difficult to be in this moment in a lot of ways because it feels like on many fronts there's this pulling back or reduction of meetings and information sharing, and I do worry about a bit of a vacuum getting created where it will be difficult for community to stay informed and may not know where to go, to even know what's going on. And I think to your earlier point, half of us don't know where to go to get data now because so many things are shifting or reducing. We've talked about a lot of different things here, and I do feel like there's some promise around, wastewater and what it can tell us, and maybe some other ways that we'll be able to keep tabs on what's going on. But I guess one question that's coming up for me, particularly given this is the last of this meeting, is, well, let's say we all know that, something's coming. How will we let community know? And are there thoughts about what will be that ongoing communications infrastructure, for lack of a better term, as we move forward? Because what I would hate to have happen is that things like this meeting not continuing being yet another signal to the public that this isn't something we need to worry about keeping tabs on, when Dr. Moss, you were just very clear in stating nothing magical has happened differently about this virus. And so that to me means there's still a need to know, for members of the community. So I'm just curious if y'all have thought about that and what that might look like as we move forward.
Yeah, I mean, Kimmy, do you want to?
Yeah, so go ahead. Say what you're going to say, because then
I was just going to say, like, we're engaged with the process of how we talk about, like, literally what's happening with, like, what data inputs are we going to have? What's the CDC? What's the state doing? How are we going to incorporate that and make that available? That is a tiny slice of what you're asking about. I'll turn over to Kimmy, but I think there's a lot of other aspects to how we put the word out. And I think we do have some tools for that, but Kimmy.
Nestor, can I go ahead and transition?
Yeah, I think so.
Okay. So, my reflections are, largely about our operations and the partnership, but I wanted to start by addressing a couple of the questions. So Dr. Abalata, it's our job to stay at the ready, to be ready to scale up and to mobilize. There are a range of things that could actually hit our community. And we had never seen anything at this scale, but now we have. And so now we know all that is needed. And so some of you have heard me say that, our infrastructure might have looked like this level. With COVID came, it like shot up to here. And our goal is not to go back to the same thing. We're coming in at right about here kind of thing. And so we have different infrastructure inside the department that is more easily activated when we have outbreaks. Donata and I were just talking about this today in terms of, as we scale things back, not making sure we're leaving in place enough infrastructure to be able to scale it back up on a dime, because we know it was hard to build the infrastructure that was needed to manage something like this over a 3-year period. And we can't really afford to let everything go away. Some things we can't control in terms of, and Dr. Moss can talk more about this, and so can Donata, we rely on certain data coming to us and being available, and certain other systems being turned on in order for us to have the level of visibility that we had during this whole period of time. We will continue to do the things that we can control in terms of the data that we do have. We will continue to try to keep our dashboards as current as possible, but they won't be the same because we just don't have access to all the data. Other things beyond us have changed. We will continue. We've always monitored. That's how we knew COVID was coming, because we were looking and we were paying attention, because that's our job. And so we have a better trained staff now in terms of activation, not just in the public health department, but across our entire agency. And so mobilizing people power was a large part of this. And so I feel confident that should a new variant come and put us in a situation where we have, large numbers and we need to scale back up, I feel very confident that we have the infrastructure, the skill, the experience to scale back up very quickly, should we need to do that. And we weren't, and I couldn't say that 3 years ago. I was not able to say that 3 years ago because we just didn't have that. We didn't have the history, we didn't have the experience, we didn't have any of the things that we have now. And so we are not turning off all of the communication pathways. So we are looking to our partners to help us know what communication methods work well, what things don't work so well. We're sunsetting some meetings, but we're standing up other groups, and kind of pulling different content together. So one of the things that we wanted to have happen here is that as we sunset this meeting is that we're going to be standing up in the next couple of months or so, a new group of sorts. We don't know the final format, but it's really for our community health improvement plan. And so while we were managing this process or managing the pandemic response, we were also working with the hospital systems to conduct a community health needs assessment and to identify health priorities. And so 3 priorities have been lifted up: access to care, which is inclusive of behavioral health, physical and oral health, income, security, and economic opportunity is the second bucket. And the third is individual and community safety. And so Yvette Brandon and the Quality Improvement and Accreditation team is working to create a process to select signature projects for us, figure out the structure that we need to provide oversight and advice and guidance. And we are looking to that body of work to hold some of the pieces of what's we're still working on with COVID. So access to treatment, those kinds of things. We'll also have an opportunity to really focus back on a lot of the other health issues that are really plaguing us. Behavioral health is a huge concern in our community: youth suicide, violence, access to chronic diseases, chronic disease screening and treatment. All those things really do have to continue to get addressed, and we need to refocus our attention. And so we will be sending out a survey to you all to identify if some of you or many of you are interested in participating with us in a different way with our community health improvement plan in terms of as an advisory body. And that will be one vehicle that we will use to continue sharing information, problem solving together, planning together. We'll also be thinking about how we
Because I don't want anybody just asking me stuff.
We'll also be thinking about how often we should have some of the briefings that we've been having. Should they expand to include more content, different kinds of things? And should we change the cadence? And so we're not turning everything off, but also hearing from you guys is really helpful to know, what vehicles, what mechanisms are the most helpful. There's internet, there's meetings, there's briefing, there's different ways that we can communicate. And so we are looking for you all to help us know what works best for you all, because we don't want to turn everything off. Some things we're dialing it down or shifting it, and some things will end, but not everything. I also wanted to just kind of reflect on, we learned a lot together. And when I was thinking about when this group started, this group originally started in order to help with the rollout of the vaccine. And you all were recruited and for that reason to help us think about how do we do this. And one of the first things that we did together, and I had completely forgotten about this, was that we did a walkthrough right shortly after this group convened. I don't even know if we had the first meeting. We were notified that there was going to be a partnership with the federal government and the state to do the big mega sites. And one of the first things that this group did was that a group of you met us at the Coliseum to walk through what it was going to look like. And you all gave your thoughts and your input into that, what they call the village area at the Coliseum that they were planning. You all saw the big vehicles that they were planning and gave them the idea of, we have to cover the sign because we cannot take these big vehicles, with the signage that they had into the community. That was so valuable. And it was a signal for us that we had all the right people. We had all the right people convened. We had them with us in our county for weeks and weeks and weeks and weeks, way longer than a lot of other communities, way longer, because we had a lot of people to reach. And we had community partners like yourselves who were working really hard to educate people, to engage people, to get people interested in getting the vaccine who were eligible, because in the beginning, of course, everyone wasn't eligible for the vaccine. You helped us manage eligibility. You helped us to think about how we set up pods, but make sure that they're not overrun by people who are not from the community that it was intended to serve. You all helped us in ways that are too numerous to even count, and really made a difference in the community and made a difference in what we were able to do around the vaccine and eventually around the other areas as well, testing, access to treatment. And so we want to take this opportunity to just really thank you all, for picking up the phone when Lauren called or answered the email when she said, would you be willing to be on this advisory group? Thank you. I want to thank Nestor and Greg for being willing to be co-chairs with me. I want to thank our staff, Lauren and Ben. I know it was rough in the beginning. We could barely even work Zoom. And you guys have done an amazing job, and you held the space for us month after month after month so well and so beautifully. And so thank you for all your hard work, all your attention to detail, and all your patience with us and with this whole process. We appreciate you. I appreciate you immensely. And we could not have done this without you. All of you that are here today, I see all of you in different spaces, but I have so appreciated the partnership. Many of you I knew before, and now I know even better. Some of you I met during this whole process and during this whole thing, and I have new friends, new partners, and I love that. And I want us to hold on the power of the partnership. I want us to hold on to what can we now do together that we learned how to do in this horrible moment that we were all in. And it was bad. We know it was bad. It was not a positive thing. It was bad. And I would not want this to happen again, obviously. And there were lots of things that came out of it that we can build from. And I want us to think about how, and we're going to kind of move into open floor. But I want to think about and have you reflect on what can we leverage that we built in this moment together. And also what has changed for all of you. I know I've changed a lot in terms of just my perspective on things, what I know about things, what I understand about community dynamics, what I understand about community health. I've been in this profession for almost like 30 years. And it was literally like 30 years packed in 3 years, another 30 years packed in 3. And I can only imagine what you all have also learned and experienced. And so we want to open up the floor for you all to share your learnings, share what has changed for you and for your organizations and the spaces that you're in, because we don't imagine that things are the same as what they were 3 years ago. And so let me make sure, did I say all the thank yous? Nestor, I don't want to leave anybody out. All of the CAG members, the staff, the co-chairs.
Our interpretation team.
Interpretation team.
Yeah.
So appreciate you all in helping us to make the meeting accessible to so many people. Appreciate you greatly. And so we're going to turn to open floor to give you all an opportunity to share your reflections on what has changed for you all in your organizations and in your spaces, and what can we learn from this and take forward, because we know our work is not done and we all are still here, and we are still here together and concerned about the health and well-being of the people in our county. So who'd like to start?
Hi, everyone.
Hi.
I want to lift all of you up, first of all, but on behalf of our Regional Pacific Islander Task Force, after listening to you, Kimmy, and, first of all, we always, in our world of faith, we thank God, for all of this first. I think our faith really got us where we are today. But for our Pacific Islanders, one of the things about working multi-county, you can see what everybody else is doing. And, my hats, if I have 4 or 5 hats, they will all be taken off and bow to Alameda County for all that you do, because you do it well. And we always feel like family. And just being here, I know we've been missed in many times in this space, but I have to tell you, as my sister Natalie, I'm here too, we've been pulled in so many directions, to be in so many spaces. But I have to say, thank you so much. Thank you, Dr. Moss. Thank you, Pastor Arlene. Thank you, Nestor. Thank you, little sister Lauren. When she first came on, we're like, okay, Lauren, okay, so we were taking advantage of her innocence and just so beautifully done. We're like, okay, but she's still the same, that your humility and just the way you carry yourself. Thank you so much. It's you that always kind of kindly remind us of this, here. Sandy, thank you so much for all you do. I came in, I learned, I met Aaron. He's my brother, Aaron. Always will be brother Aaron. Many of you I've met in so many spaces, but my heart is full because I know I could continue moving forward with what we need to do from our end, knowing that, you have our backs, and same here. And what we take away, like Kimmy was saying, how do we leverage what we've learned? I can tell you, we came in with knowing no one, no community, no organization. And with the coalition model that you do have, yeah, there's a lot of room of opportunity, but boy, do we have a lot of good friends. And had it not been with these partners, no one would be servicing us at the May Day with our Native Hawaiians, and the big May Day bash this weekend, because of the state emergency canceling. Having partners like all of you, La Familia has been there with us all the way through, but we have Yamoja doing our vaccination this Saturday, right on, but you guys, it has not been happening. We couldn't have done it without the partnership. That partnership will take us long ways, because what we've learned as Pacific Islanders, it's like, let's get our narrative right, and let's know our own priorities. And then we move to the center with all of our BIPOC community so that we can learn together. And we have a lot of alignment, a lot of, similarities in our coalitions. And I said, we couldn't have done this work by ourselves. We're already small, but to think that we have, partners and strong partnership in Alameda County, you guys know this is how we do it. It's community. That's what community is all about. Kimmy, your guidance, Kimmy knew us since we started, since we're infants. We were there from day one. So she knew us. It was family all the way. There are times, we would, be, confused about things, but boy, do we know how to settle it, And so in many spaces, we now can say, we can talk to her, we can say, Kimmy, I don't think this is working, or da, 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 and it was always like, okay, so how do we do it? It was that understanding, it was that learning process. And so we are so forever grateful, for that space. And what has changed us? What changed us is that not only are we, just looking within our Pacific Islander, but how do we become also thought partners with educating outward, and how do we work together, finding common grounds? And yes, we are a small population. We have been underserved and unserved, but how do we find commonality with other small populations as well, so we can advocate together? But there's always teachable moments that we can find. And I think a lot of what we all do, we have so many similarities. Oh my gosh, we can go forever. But anyway, for not to ramble on and taking time, but there's a lot to be leveraged here. There's power in people and community. And let's not forget that. And I think the continuation, how do we improve from what we've learned? And how do you put the strength together? And those that need more help and more capacity building, sort of look at those partners and how we can help bring them to where we are as well. But we've grown, we've matured, and we need to get a lot more savvier in our time management, because getting off work at 7:30, 8 o'clock is not cool to my husband. And so, that's just the way it is. But anyway, thank you so much. And, thank you very much. That's all we could say. So that's right.
Thank you, Taunu. Appreciate you. Who else? Who else would like to share learning and what has changed? Sheridan.
Yeah, I just wanted, so many wonderful things have been shared already, but I was just reflecting on, over the last 3 years, the different parts of our community that have been able to reach out to our office to get support with systems navigation, including folks with co-occurring multiple disabilities that maybe haven't been connected to the developmental disability spaces or services, but have had people reach out, including people who are unhoused, people who never considered themselves as somebody with an IDD, even though that was one of their disabilities. And they reached out because either they watched one of these CAG meetings, or they were connected to our office from a community partner taking place on the CAG. And I just wanted to thank you all, for that. And I think that's it, right? I know that there's been plenty of times where I've talked about the wonderful work of our partners here. And I frequently have shared, these promising practices and best practices with the work here with the partners. I've shared it in other parts of the state. Not all parts of the state have been able to rally around each other and support each other in this tough work like this group here and like Alameda County has. And so whenever I can share those lessons learned and share the amazing things that you all are doing and that we've been able to do together these last handful of years, I'm just very, very grateful. And we know it won't stop, right? We know all the ways that we will continue to network and to make sure that we can, use our connections and our network and our knowledge of each other and each other's work to plug those gaps, to identify the weak areas and to get those filled together. So thank you all.
Thank you, Sheridan. And yes, we learned a lot. We learned a lot.
Mm-hmm.
Who else? Is that a real hand, Pastor?
That's my real hand.
Okay, go right ahead.
Yeah. Well, I can't even begin to summarize everything I've learned in the last 3 years. But one of the things, that's really meaningful to me is that, I love knowing what your faces look like. And even though I haven't seen most of you in person before, and having a sense of each of you as people, and approachable. And, I seriously, at the beginning of the pandemic, I pulled up the county website and I was just smiling and dialing and leaving messages on people's voicemail, begging for help for Cherryland. And I didn't, I just like, oh, that kind of sounds like a title of a person that might be able to help. But I didn't know the people really. I only knew 2 people in public health in the county personally before this mess and stuff. And so a sign of growth for me is that, I feel like I have a personal relationship with almost everybody that's on this advisory group now. And that's a blessing. And I guess so that's nice for me. But I just want to say, I think that's something y'all want to strive for. You want to have a lot more people, who didn't know you before to know you as people and feel comfortable reaching out to you and having multiple ways of reaching you. And like when little people from the neighborhoods reach out to you, reach back, right? I think that is something to really work for continuously. I also want to say how important and helpful it was, at the very beginning for us. The only government work we had ever done in our lives was to help with the census. That was our one and only public contract. It was huge, to us and onboarding with this work to have Tuari Anderson, had already been participating in the Ashland Cherryland needs program here, or I don't even know what, the table, the group that we have that meets monthly that talks about the needs of our neighborhood. And so she was already, a page ahead of most people in public health. And then on top of it, she actually she does understand small nonprofits and that we can't survive $500,000 delays in compensation. She advocated for us to have financing up front, so we didn't have to sell stock from the church building fund in order to cover payroll. We need more of that. We did at one time, between the people we were subbing for and the county work that we were doing directly, people owed us $800,000. That's more money than our operating budget the year before COVID. So I just want to say, thank God I'd been here 20 years and people in the congregation, didn't want to fire me because we were $800,000, out of money. But I would say a lot of other congregations might have quit, and, you need more people that understand small nonprofits and small faith-based organizations like Tuere, if you're going to have the deep and, particular knowledges that you're going to need to be effective with very diverse populations, right? So anyway, snaps for Tuere. I'm president of our fan club. And I also, want to say, it has been real hard sometimes, some of this work. And, George Ayala was brilliant and masterful in leading us through a very difficult process of rebuilding one of the coalitions. I know that he didn't just hatch those gifts overnight. That's, a tribute to a lot of years of experience. And, I thought he had an extraordinarily cool head and gracious, but, clear and guiding hand. So I appreciate that about George. And yeah, okay, I'll let somebody else talk now.
Well, I want to make sure that we have time to kind of shift to the next segment, and then there will be time for people to also say more. But before we shift over, just want to let you all know that we are going to be getting in touch with you all, not just about the survey to see if you're interested in being, in another group or another arrangement, around some other stuff, with us, but also we want to have a get together. And so we would love to have an in-person get together over the summer. So we can all see each other in person, share some food, drinks, kick it, hang out together, whatever. And so looking for any ideas that you all have, but we will be in touch with you all to do something, laid back and relaxed, so that, like I said, we can all see each other and mix and mingle in the live and in the flesh. Because you're right, Pastor Arlene, some people I've never seen in person. And so, yeah, it's past time. It's past time. So I will turn it back over to Nestor. I think we have our next segment.
Yeah. And I think, in fact, we're gonna go to Donata, actually.
Yeah. All right, and Sandy.
Yeah.
Mm-hmm. All right. Good evening, everyone. It was really great to hear all of the reflections, and the partnerships have been amazing. And it's been just an honor to be part of this whole process and getting to learn and know all of these amazing partnerships. So we really just wanted to share some pictures and do a really quick overview of the timeline. So if you can go to the next slide. Really the focus is the CAG partnerships, but I just wanted to take a quick trip back to where we were a little bit over 3 years ago, starting in January of 2020, when we actually activated our Department Operations Center. And all of you know, it's been a windy, very, very windy road with lots of pivoting and prioritization and really figuring out where the resources need to go and where the gaps are. And then between March and April, we had, the emergency declaration, and then we had the shelter-in-place order, which was supposed to end in April, but then it did get extended. And then we had our first large summer surge in July of 2020. At that time, we still didn't have vaccines, but then finally in December of that year, we got our first COVID vaccines, which we pushed out on December 18th to first responders. And that was when we had our first CAG meeting, and that will be coming up in the next slide, some of the reflections of that time period. And then in February, as you know, we started our mass vaccination campaign and our pods. And that's also when we stood up our COVID division to really continue the COVID response work. And then in 2021, at the end of 2021, we had already been able to vaccinate at least 80% of our residents had had one COVID vaccine, which is quite a feat for such a large county, within that short time period. And then, of course, we thought we were out of the woods, but we had that big Omicron surge at the beginning of January 2020 with over 6,000 cases at the peak on one of those days at the early January. And then we realized, the masking needs to continue. We had a lot of discussions with community partners. I know Nick had participated in several meetings to discuss masking. And then, a lot of things have happened in between this windy road, many things that we could probably spend hours just talking about all the things and the partnerships and the isolation care kits and outreach, health education, all the wonderful things that we all did with all of the community partners. And now we are here in May, facing the end of the emergency declaration. But as many of you have said, and as Nick said, it's not the end, and we're here to continue our response work over the next year and beyond. But we did want to share some pictures and just reflect on, the community partnerships and what we've done together. So I'm going to turn it over to you, Sandy, to share some of that.
Thank you, Donata, and thank you everyone for your reflections. Just today I was talking with a community partner. We met in Newark. We've been doing some community visits these last few weeks, and we just talked about, like all the beauty that came out of such a horrible time in our lives, and really just about just the power of the relationships and partnerships that we've built with each other. So just kind of briefly, going down memory lane, we wanted to remind ourselves of what we've been through together. Our first meeting, as Donata mentioned, was December 21st of 2020. We were a mix of residents and community serving orgs, health experts from across the county and really representing our highly impacted communities. And we chose to have these regular meetings that were open to the public. Our purpose was going to be sharing information with you all and the plans with the community, get your input about how to provide an equitable vaccine distribution, how to prioritize our efforts. We built collective trust and strategies to help make folks in the community make informed decisions, and to get your input and your support around how to do our messaging and managing misinformation. Originally, we met bi-weekly, every 2 weeks, and then we started meeting monthly through the spring of 2021, and then we expanded beyond the vaccine to really focus on the whole COVID-19 response, and really how we get more information and outreach and education to the community. Next slide, please. Also part of our memory lane, as Kimmy alluded to, when we began, we had all these tiers, all these complicated tiers we had to go through, and how could we include as many people as possible from our impacted communities in each of these tiers. And then, thankfully, then we got to with enough vaccine for everybody. Next slide. Our vaccine strategy evolved over time. We had our mega pods that we just talked about at the Coliseum. We also had one at the fairgrounds. We had our stable community pods. Then we evolved into all of our mobile vaccine pods that so many of you have participated in since July of 2021. And then we worked with so many different partners, our community health centers, hospitals, different, smaller providers, pharmacies, others, and then all the different folks here that also served as mobile vendors for us. So our strategy has shifted over time. And here are some pictures from the top one, I don't remember what school that was in, to be honest. I'm looking at it and I can't recall. And the bottom one I know was from the fields over at Fremont High School, their first community pod. Next slide. As Kimmy also reminded us, one of the first things that the CAG did was give some advice to our federal and state partners on how to make the Oakland Coliseum pod as accessible as possible, and how to set up mobile sites. And so many of you stood up to help host mobile sites. Next slide. And then in July, once we reached most of the eager beavers in by the end of June, and then in July of 2021, we really started looking at we have to expand our strategies to really try to be much more nimble, set up many more clinics, pop-up clinics with partners all over the place, and where folks feel comfortable, have trusted relationships, and are and will continue to seek out vaccination. And so we worked with so many different partners, some for a one time, and some have continued on, like Serenity House. We're still doing those clinics once a month. And the pictures we have here are from the day labor vaccination pop-up sites, which were monthly in the Fruitvale area, with a deep partnership with Street Level Health, La Familia, and Homies Empowerment. Our next slide. So what were the things that we talked about in this space? We talked a lot about data. Every meeting we shared a whole bunch of data with you about where we were. We shared changes at our policies, both at the local level up to the state and federal levels. We shared new changes in our health directives. We talked a lot about how to help people, help our vulnerable populations increase access, help guide our strategy for the county, and gave us input on our vaccine and health recommendations, how our media and communication strategy should work. And then you all shared wonderful updates, motivational updates every meeting around what you all were doing and how you could help each other. And seeing the synergy of efforts that came across in the space was a very beautiful thing to see from us. We also had partners from the schools talk to us about COVID in schools. EMS shared with us around their system redesign and took input on that. When Mpox, the other pandemic started during the pandemic, Mpox started, we shared some information about that. And then we've had several conversations these last few meetings around the end of the COVID emergency declaration and what that would mean for our communities as far as accessing services and all the other things like housing and other things that would be impacted by that. Next slide. Continuing also, we talked about the tour. We also we did a vaccine attitude survey with youth, and we set up a youth CAG advisory group for a while. As we said, we already expanded to beyond just the vaccine to talk about our COVID-19 strategies and all. You shared, reflections with us. You advised us on what those strategies should be for our ongoing efforts and our strategic refresh during 2022. We also had some really good conversations about how we can all together help shape social norms ongoing as we come out of COVID. And lastly, as we just all talked about, we built a lot of relationships, really deep relationships with each other, amongst community partners, as well as with community partners with us as a health department. And so it's just a reminder of all the folks that were, many of the partners that we've just worked with, so many orgs represented here, and then a lot more. So this is just some of the visuals of all the different organizations we partnered with organizations, not just in the vaccine work, in the testing work, and outreach and health education work, case investigation and outreach, and our isolation and care kit distribution. So we've just, and some orgs just did heavy lifting for just through all of those. Some were just partnered with us on one of those efforts, but we just couldn't have done this without just the tremendous outpouring of support and leadership that came from all of you. So here's the list of all our folks. In the interest of time, and also just to open the floor to hear from you all, allow for more reflections. Not going to read through all of them, but just immensely, we want to thank you for being with us for these last 2 years, sharing your pain and struggles and frustrations with us, helping us be better, letting us know when we were doing well, letting us know when we weren't. And as Kimmy said, I'm also so happy to have so many new friends, and looking forward to all the ways that we could continue to partner with each other for COVID and all the other things that we touch in our community as a health department. And so we're gonna, Lauren, are we gonna show pictures now and then open the floor for reflections? Is that it? So now we're gonna go down memory lane with a lot of pictures of that. And thank you for all of you that submitted photos to us to help us remember what we've been through together.
Yep, that's it. I'll share some pictures. In a dream world, I'd have a beautifully musical slideshow, but I'll just show some pictures and maybe you can hum to yourself. But I thank you to folks who shared some of your pictures of all of the incredible work that you've been doing and all the people.
BYOM, bring your own music.
Bring your own music. So pick a tune while we flip through some of the pictures from that many of you submitted. So thank you. Somebody else playing music? Ooh, I don't have that. I think that was about it. So thank you. I'll make something with music and send it to you.
And we're still accepting more pictures. So if you all have pictures that you would like to contribute to the collection, please do send them on to us. And I think we are, Nestor, opening the floor for other partner comments. I think also George has put something in the chat that we have a RFP that is on the street right now, and it's for capacity development. Please take a look for categories of funding. I think that there are going to be there's some interesting things in there that you all might like. So please take a look. Nestor?
Yeah, so you know, we're coming close here to the end of our meeting. Before I open it up to any last thoughts or takeaways, I'd like to do a shameless plug for the Public Health Commission. If you yourself live in Alameda County, or you have constituents as part of your organization, members of your organizations that you think would be great leaders on the Public Health Commission, and that could continue providing valuable insight to not only our public health department, but our county on issues around public health that go beyond COVID. And you know, as Brother Aaron was talking about, getting to the social determinants of health, you know, that's what I think all of us are here to address at the end of the day. So want to invite you all to send us your best, your brightest, and if you're just interested in learning more, you know, we meet the second Thursday of every month. We're meeting this Thursday. You're more than welcome to. We meet at I forget the address, Kimmy, of the building there, Creekside.
1100 Leandro Boulevard.
In Leandro. You also can participate via Zoom. So that's the end of my plug, but I want to open it up to the group and see if there are any last thoughts, comments, reflections, sort of takeaways before we begin to close out. Yeah, Aaron, and then we'll go to Bruce, Dr. Bruce.
Again, thank you to Alameda County Public Health. We had a lot of hard times that we all worked through in serving the community. It wasn't easy work. It was great work for the community. It was transformational, and just a lot of great partnerships that took place. I'm humbled by the work that we got a chance to do, that La Familia got a chance to do. Never in my wildest dreams did I think that we would be involved that way. And it was truly a blessing. So with that, I'm going to say this. As this transition from the pandemic to the endemic continues to unfold, I want to invite you to fight harder, to stand together, and to recognize that we are who we've been waiting for. My call to action to you is our shared values that we have in common versus the scrapes that keep us apart. History is more than the path left by the past. It influences the present and can shape the future. I challenge you to continue to lead in poetry, to educate in excellence, to keep our passion for freedom, to fight against injustice, to protect the health of those without wealth, and to seek the precious balance between security, which is too often threatened, and human rights, which are too often denied. History is not the burden of one person alone, but some are called to meet its challenges. It is a duty that we confront with a dignity, a determination, and a distinction that are widely admired. Abraham Lincoln, Martin Luther King Jr., and Cesar Chavez. Team, most people can handle adversity, but if you want to test a person's character, give them power. I want to thank you for co-powering with La Familia, for co-powering together, and thank you for partnering.
Thanks, Aaron. Dr. Bruce, you had your hand up.
I don't know how to follow that.
Tough
That was
act to follow. Tough act to
Aaron,
follow.
that was wonderful. No, I learned a lot from being in a group this large, which is probably one of the largest groups I've ever been in. I have to apologize to everybody for my mouth sometimes. Things just sort of spill out of it, and then my brain says, why did you say those things? And this really has been a different type of experience because most of the committees I've been in the state of California have been all of us together in a room or whatever, traveling heaven only knows where to a different county to do things. I'm really impressed. I'm impressed with Kimmy. I'm impressed with everybody. I probably saved myself with a number of times I emailed Lauren. And she's a wonderful person, can make you say, think about what you're doing, think about what you're saying, I understand, and deserves a huge round of applause as far as I'm concerned, with how she's handled everything that's gone on with dealing with this committee. Again, I've learned a lot about a committee this big because I've never been in this type of committee this big. And when you have a separate kind of thought, how does it affect everybody versus the person you're kind of sitting across the table from? And again, if I've upset anybody, especially Kimmy, I'm really sorry. Things just sort of, I look at things sort of in a little bit different way, being a pediatrician as pediatricians do, and a lot has to do with how you come across with what you say, and just one word here or there can mean losing a patient or not, and that's probably the way I'll always think. You also gave me a lot of information because it didn't matter what store I was walking around, having been a physician here in over 45 years in this area. Everybody came up to me asking me about COVID practically every place I was. And it was really nice for it to cool off in the last year and not be assaulted in Walmart or Safeway or whatever and have a 10-minute thing. And then when I finally got home, my wife says, "Where have you been? You just went out to get milk," so to speak. All right. So goodbye, everybody, for now. I would love to see you all again. And thank you for all the work you've done.
Thank you, Dr. Gott.
Any other thoughts, appreciations, reflections, updates that anyone would like to share before we go back to Kimmy and Dr. Donata and to close us out? Yes, Lauren.
I admire everybody on this call, and I am just so humbled that I got to learn from everybody here. This is just an incredibly powerful group of people who continue to give and continue to give and continue to lend expertise and continue to show up even when they're exhausted and continue to build something new and keep hope going and keep holding people to task and keep people accountable during like really crappy moments and just and fight for what they know. And it has been a true honor to send you all Zoom calendar invites and hit record. And I make jests, you know, I don't mean to make light, because this the opportunity to work together with people on something like this makes me hopeful for all the other stuff that we have to eradicate to help people live longer, healthier lives. And I know that this group has been committed to that with like every fiber of their being in their work. And it's been really incredible to get to witness people building and riffing off each other, and to be willing to be in a relationship with government for that, because that's you know, that people walking in with their own wounds in that way. And so I just really want to appreciate the honor to be in this space with you, and for all the knowledge that that you've brought, and the fight that you've brought, and the lives that you've saved. Thank you.
Thank you, Lauren. That was I think that was perfect. And I'll transition that. I'll transition us now back to Kimmy and Dr. Tanada.
So I think, so one of the things that we wanted to, I think I said everything that I wanted to tell you all in terms of, we will be back in touch with you because our work together, we don't believe is completed. It's different work, more expanded work, keeping our community safe and healthy, able to live their best lives. And we are going to reach back out to you to have some kind of gathering in person so that we can all see each other. And we are still wanting to hear from you around what kinds of things when you think about the expanse of our operation, not just the CAG, because most of you interact with us in other spaces too. It's important for us to know what kinds of things worked well for you in terms of the meetings, notices, structures for communication, because we don't want to cut off all of the communication avenues. That we don't want to do. And we have no intention of doing that. And so things will be pared down, but it would also help to know what kinds of which channels worked really well and what didn't work so well. Donata's going to now share some information with you all that we have kind of put together in terms of the resources that are still available. As we've consistently said, you know, our work is not done in the public health department around COVID, and it's further in the background than it was before, but it is definitely not gone. So Donata, I'll turn it over to you to close us out.
All right, thank you so much, Kimmy. So the flyer that we've been working on is almost done. I was hoping to share it today, but basically everything I've been sharing for I think a couple of months, also in the briefings that we have on Wednesdays, as Dina we'll be continuing our testing operations, our vaccination just at a lower, a reduced scale. Our COVID email will continue to be available. We'll be responding to that. And then our phone number will also continue to be available for people to call about resources, questions about testing, vaccination appointments. That will continue at least through the next fiscal year. So through next June, those numbers will be available. But as soon as that flyer is completed and final, I'll have Lauren send it out to everyone. So you'll have that to refer to and send out to your communities.
Right.
So we're not going away.
No, we're not. I think that's a wrap.
Thanks, everyone.
Thank you, everyone. Have a wonderful evening. And thank you again for all that you do for your communities. And thanks for the partnership. We appreciate you.
Maria, thank you. Thanks, Laura. I will see you. Oh, there was a request. Yeah, eating something as usual. I'm sure I will see you all soon at Navigators. Thank you. Dr. Bruce. We still have each other's email. I still actually, you know what? I still have your phone number. I can still text you. Thank you for everything.
Bye-bye.